in as unambiguous terms as we possibly can. If Omicron continues to spread at the rate at which it is spreading, what does the rest of December and January look like?
Well, I think we're still learning about the virus. What we do know is that Omicron is spreading much more quickly. So of course, people were looking forward to enjoying Christmas a little bit more this year, but now's not the time to gather in big numbers. So I think that is the biggest impact on people, and reducing contact is very important at this point. I think that will help preserve our hospital capacity. That's what we're most concerned about. So even if Omicron happens to be milder than the previous virus variants, because it's spreading so rapidly, that even a small proportion of people ending up in the hospital is going to overwhelm our systems.
And how confident are you at this point in those initial reports that we heard that Omicron could be milder? Is that true?
All of the cases that we have in Canada so far have been mild or even asymptomatic, but right now it's affecting the younger population. So we don't know what it's going to look like if it does spread into the higher risk. And we want to prevent that from actually happening. Even if it's a milder variant, it can still impact our healthcare system really rapidly. Because it is so highly transmissible, it can creep up on you really fast. That's what we learned at the beginning of the pandemic as well, is that at the beginning, the numbers may seem small, but it's actually still the tip of the iceberg. We don't know where this virus is spreading in many different communities, and it can then suddenly increase what we call exponential growth, and that can occur very, very rapidly.
On masks, are the sort of fitted cloth masks or even the paper blue surgical masks, are those good enough?
You cannot have a single layer cloth mask. We've recommended for a very long time multiple layers with a filter. The medical masks are better at filtering viruses, but more importantly, something like a respirator is a better fit for people's faces in general. So that's why if you can get your hands on respirators, KN95 masks, that's going to give you a better protection. But don't wear it underneath your nose, or wear it underneath your chin. That's really, really important.
A few moments ago, you mentioned communities. What settings are you most concerned about? Where are we seeing the most community spread?
Prior to the appearance of Omicron, we were getting escalations in cases and outbreaks in schools. So there were elementary schools and kids under the age of 12 that haven't had the benefit of even getting the first dose. So that's where we're seeing most of the outbreaks. The beginnings of the Omicron variant outbreak seems to have been occurring in younger people. So we've seen it in educational settings, universities, sports games. All of those seem to be the initial big spreading events. What we're concerned about then is now spreading into other contexts as well. We are beginning to see spread in workplaces. So I think the really important thing is we learn how to protect those workers, making sure they have the best mask possible that you can get your hands on, making sure ventilation is improved in those workplaces, and making sure that they get access to vaccine, because sometimes they work different hours to when vaccine clinics are open. So making sure that they have access is really important.
So let me ask you this then. I mean, when we look at restrictions across the country, varies by province, obviously, but when you look at those writ large, are they precisely where they need to be? Do they need to be stricter? Should they have been implemented a week ago, 2 weeks ago? What are your thoughts?
Well, we've only learned about the Omicron variant for less than a month, so I think we're learning really fast as we go. Now that we know it's such a highly transmissible virus, the key is to act fast and as hard as you can now, because putting on the brakes, as we all know, quickly can allow us to resume activities at the other end faster. But I think we need to be taking a more preventive and precautionary approach because of just how fast this is spreading.
So I just want to make sure I understand you correctly. More restrictions is what you're suggesting here would be prudent, as opposed to simply relying on the goodwill and good faith of people to socially distance.
I think you have to do both. I think workplaces, more structured gatherings are easier for public health to put restrictions on, but it's very difficult to control every household, etc. So I think we've all learned how to minimize risk and do our part.
In terms of risk and spread among those who are vaccinated, you know, we used to think of this pandemic as being a pandemic of the unvaccinated. Is that still true?
I think this is still true in terms of the unvaccinated remain at much higher risk for serious outcomes like hospitalizations and deaths. So from that perspective, yes, this is still a pandemic of the unvaccinated when it comes to severe outcomes.
Dr. Tam, thank you.
Thank you very much.